Good morning. Thank you all for joining us for the second installment of the Los Angeles County Economic Development Corporation's COVID-19 Economic Implications webinar series. Today, we will be joined by LAEDC CEO, Bill Allen, and the Director of the LAEDC's Institute for Applied Economics, Shannon Sedgwick, who will provide insight into the impact of the COVID-19 pandemic has had on the region's economy. Now, without further ado, I'd like to introduce the CEO of the Los Angeles County Economic Development Corporation, Bill Allen.
Thank you, Shane, very much for kicking us off and getting this organized. Welcome to everyone who's joining us for our second in our series of economic updates on the impacts of COVID-19 on our regional economy. I want to thank you all for joining us today, and since many of you are longtime members and partners of the LAEDC, I want to thank you for your steadfast support of our organization. I hope you're all well. I hope you all enjoyed a nice holiday weekend, and I really do appreciate you spending this half hour with us. We're going to try and do these efficiently for you each week, just in 1/2 hour, to give you the latest information we have available to help you make more informed decisions in your work. Our organization is traditionally called upon to provide more economic insights, more small business assistance to even micro enterprises and community serving nonprofits during periods of economic disruption like these. We are additionally called upon for policy advocacy and connection to essential resources that are so necessary during times like these. And that's why we, again, appreciate your support of the LAEDC that enables us to provide these important resources when they're so desperately needed at this time. As in past periods of severe economic disruption, your LAEDC staff is once again rising to the occasion to meet the moment. And I want you to know how proud I am of each and every one of them. And you will hear from one of them today who represents our Institute for Applied Economics. I have good news for you this morning, and that is that we appear to be making substantial positive progress in Los Angeles County as a community in our social distancing efforts to slow the spread of the virus. Because of the leadership shown by our city, county, and state leaders early on in mid-March, establishing these stay-at-home orders and social distancing initiatives, and because we have all followed them well, we are seeing a flattening of the curve. In fact, we have seen less deaths in Los Angeles County and across the entire state of California in the last month of this experience together than the city of New York saw in any single day last week. That's important as the most populous state and the most populous county in this nation. Things could have been much worse. But that doesn't mean we can let up anytime soon. The fact of the matter is our county has extended the stay-at-home order until May 15. We believe it's the right thing to do for public health and for our eventual economic recovery. And we encourage all of you to support those initiatives, to be leaders in your communities, encouraging others to stay at home, but to begin preparing for economic recovery. It's not clear how much beyond May 15 these orders will stay in place, and a great deal of discussion is now occurring about the conditions for reopening our economy, even if it is to be reopened in phases. The likelihood of that happening in the weeks after May 15 seem to be increasing with the availability of additional testing, technology for case monitoring and contact tracing, as well as additional supplies coming online of personal protective equipment, hospital beds, ventilators, the other resources our healthcare industry needs to be sure that anyone who continues to contract the virus gets the full care that they need. Exactly when and how the economy will be reopened remains uncertain, as does the ultimate impact the COVID pandemic will have had on our economy. We know it will be far larger than the effect of the Great Recession. We know that it will have a disproportionately painful impact on our low-income communities of color, who are disproportionately represented in the industries, particularly service industries, that have been most affected by the social distancing orders. We also know that consumer behavior is changing and supply chains are changing. We don't know how lasting that change will be, so it creates challenges for all of us in the public and private sector to forecast what consumer demand and job demand will look like in the months and years ahead. And that uncertainty is the theme of today's presentation from the director of our Institute for Applied Economics, Shannon Sedgwick. I'm going to turn it over to Shannon to present on the theme of uncertainty and to hopefully address some of the questions that came up in our prior seminar last week. I think you'll find she has addressed those in the slides she's prepared for you all today. So Shannon, it's all yours.
Thank you, Bill. Good morning, everyone. Thank you for joining us for the second in a series of webinars to discuss some of the economic implications for Los Angeles County related to the coronavirus. I hope that you and your families are staying safe, staying strong, and very importantly, staying at home. Today, I'll be sharing more local data on how the coronavirus is impacting Los Angeles County, including potential job losses over the short term, and even a few points on how the coronavirus interconnects with demographics. The number of confirmed cases of COVID-19 in Los Angeles County exceeded over 8,000 this past weekend, and we are entering our fourth week of the stay-at-home order. The stay-at-home order was issued by Governor Newsom on March 19th and by the County of Los Angeles on March 22nd. Nationally, for the first time in history, every U.S. state is under a disaster declaration, which allows state and local governments to access federal funds during the pandemic. As you listen to financial earnings, GDP, and even labor market forecasts and projections of the impact of the coronavirus on the economy, you will often hear the term uncertainty. What is uncertainty and why does it impact our ability to make predictions? Uncertainty exists when an event is highly improbable or unquantifiable, or when an extraordinarily large variable, such as the many trillions of dollars in Fed and Treasury stimulus that will continue to be directed towards many parts and sectors of our economy, is entered into the mix, or when consumers start changing their usual behavior in a sustained fashion. Taken together, this definitely sounds like the COVID-19 outbreak, hence the forecasting uncertainty. There are many examples of events which have introduced uncertainty into the global economy over the years, including the assassination of John Kennedy, the OPEC embargo crisis in 1973, the terrorist attacks on September 11th, 2001, the financial crisis that kicked off the Great Recession, and even our last presidential election. These exogenous events cannot, of course, be predicted like a cyclical downturn or be explained by existing economic models, and pandemics fall into this category. The IMF just released a brand new World Pandemic Uncertainty Index last week, where you can see just how much uncertainty exists during our current global health crisis. Or you can simply just consider the rapid and large swings in the bond and equity markets over the last month, and watch the violent movements in the so-called Fear Index or VIX Index, which tracks broad investor sentiment and psychology about the equity markets, shifting between investor caution and opportunity, sometimes in a single trading day, based on perceived underlying economic and financial factors. Uncertainty. There are so many questions that impact what recovery may look like. When will COVID-19 peak? What will be the number of infections and deaths? How long before the stay-at-home order is lifted? And how will it be lifted, in a phased approach or all at one time? How large and ultimately effective will the stimulus be? How many businesses will go under? How many people will lose their jobs? What kind of behavioral changes will result? Will COVID-19 reemerge, and what will that look like? When will there be first-line therapies to treat and or vaccinate to prevent COVID-19? How will other countries, global markets, and thus supply chains be affected, and for how long? All of these questions, these unknowns, make projections and forecasts difficult during this crisis, as there is a high likelihood that the assumptions used to generate these estimates may not be even close to accurate. For example, if we base our forecast on the assumption that the stay-at-home order will be lifted and activity resumes at the end of April, but the disruption continues into June, then our projection for this quarter and the entire year would of course be grossly optimistic. And our mandate here at the LAEDC is to inform based on what we know already and can extrapolate, or based on what is reasonable to predict based on what the data together with our models are forecasting, not to attempt to speculate based on wholly lacking information or to make unsupported broad predictions at this early and, dare I say, uncertain point in the health crisis. So what do we know? We know that over 1.2 million initial unemployment claims have been filed in California over the last 2 weeks in March. We can identify industries with the highest risk of job loss based on whether they have been mandated to close or are considered non-essential. We know we are supposed to practice safe distancing, and we know the physical proximity required for workers across different occupations. We can use this knowledge to create preliminary short-term projections of initial job loss, and then use those projections to make regional comparisons. And while the different MSAs in Southern California all seem to have projected job loss of between 20 and 30%, that looks very different when you are looking at the number of jobs which may be lost across the regions. We will be releasing a brief analysis that includes these short-term projections for initial job loss in Southern California later this week. To wrap things up today, a recurring question we are receiving has to do with the demographics of high-risk industries. Are certain age groups or individuals of a certain race or ethnicity facing more risk of becoming unemployed? Looking at the distribution of workers by race shows there are a large number of Hispanic or Latino workers in all of the industries with a very high risk of job loss, especially in the hotel industry, where they account for over 56% of the total workforce. With the exception of the arts, entertainment, and recreation industry sector, Hispanic and Latino workers account for the largest share of the workforce across very high-risk industries. The distribution of workers by age is more evenly distributed, though about half of all workers in food services and drinking places are under the age of 35. Next week, we're going to describe the risks for job dislocation at the city and CDP levels and dive deeper into demographic factors, including ethnicity and age.
Now we're going to move into some question and answers for the remainder of this morning. So Shannon, I believe the first question goes to you. Question is, do you have demographics data in relation to unemployment to understand the economic impacts by group, which I know you just discussed? And for example, what is the unemployment rate by ethnicity, age range, gender, and socioeconomic status in Los Angeles? And will this information be available to us at a later date?
Well, right now, the only unemployment data available for the Los Angeles area covers the month of February, which was before the stay-at-home order was in effect and unessential businesses were mandated to close. The next data release for the month of March, which will begin to show the impact of COVID-19, should be coming out later this week. Demographic labor force data is available for California. Right now, that data is also for February, but as I said, March data will be available soon, and we'll share that information as it's released. If you're looking at unemployment before the coronavirus, typically African Americans and youth experience higher rates. It remains to be seen if that will hold true going forward.
Bill, the next question I believe is for you. Based on the experience of the world, US, California, and Los Angeles in 1918, how will the recovery for Los Angeles look, and what actions are being taken now that will change or improve the outlook?
So I looked back at a report recently written by a couple of Federal Reserve economists about the 1918 Spanish flu experience, particularly here in the US and in California. And it noted that the cities that reacted quickest and went deepest with their social distancing measures, which were disproportionately West Coast cities because the virus happened to emerge initially on the East Coast in that experience, they had a stronger recovery. They were more severe in their social distancing measures and probably had a stronger short-term negative impact on their economies, but they enjoyed a greater economic recovery than those cities that did not aggressively social distance. So I think the first thing that we're doing here on the West Coast, as witnessed by what's happened in Seattle and San Francisco and Los Angeles, is that areas that could have been much worse hit have seen less of a health impact Now, that's had a disproportionately large economic impact on us as we've taken these short-term public health measures, but it may put us in a better position for long-term recovery than a city like New York that has had a deeper health impact because it was a little late in terms of issuing its social distancing orders. And what the research shows is that even days matter, being 1, 2, 3, 4 days late in putting these guidelines and orders in place has a difference in the shape of the curve and the total number of cases. And according to the Federal Reserve economists who reported on this last week, it can lengthen and slow the period of recovery. So we think that's been a good step. Second is, our city and county and state are now beginning to put together advisory teams to look at how they can accelerate recovery. What are the responsible roles of a city, county, or state in creating the conditions that will be supportive, that will facilitate economic recovery? We believe these conversations need to go industry by industry, because what the entertainment industry will need to produce television and film programming will be different than what the restaurant industry needs or what the manufacturing industry needs. There'll be similarities, but there'll be differences. And there are appropriate policy responses to be taken. And so we're going to be doing further research into what policy moves were made in prior pandemics, but we're also starting to engage in conversations through the LAEDC with leaders in these different sectors, and in conversation with our public sector partners as well, as to what we can put in place across a variety of potentially financial incentives and non-financial incentives to allow for a more robust recovery, keeping well in mind that we're not just turning an economy back on. There are people who talk about a certain date they would like to have the economy just turn back on. That's not realistic. It's not, as we see it, what's going to happen, but there will be phased recoveries of our economy based on the ability to keep workers and customers and the general population safe. And so this, I think, is a fascinating part of conversations that are going on in our organization and across the region to ensure that the right worker safety protocols are in place, that we have the necessary testing, that we have the necessary contact tracing and case monitoring ability, that we have the safety equipment in workplaces, the cleanliness in workplaces, the social distancing initiatives to keep people from congregating too closely, particularly without masks or other protective equipment for the general population. And I think as we work through these, we'll be able to open up more parts of our economy more quickly and see a more long-lasting recovery. All that being said, this recovery is not likely to be, the 2 or 3 months that it took for us to lose so many jobs. And we're only 1 month into this and we've already lost millions of jobs. We'll lose considerably more jobs in the next month or two. I think everybody is reasonably clear it's not going to recover in the same 2 or 3 months. I think UCLA has updated their forecast twice in the last couple of weeks to indicate that it could be a couple of years of recovery involved. And as Shannon said, as uncertain as it is to predict exactly how many months or years and exactly how much of the economy is recovered and what is the shape of the new economy, the reality is we can have a beneficial impact on the shape and speed of that recovery by instituting strategic decisions at the private sector level and the public sector level, including in our own enterprises. And we're really impressed at the LAEDC to see the innovation that's going on in industries, to see the way our garment industry is manufacturing personal protective equipment, to see the way the restaurant industry has shifted to takeout, to see the way many retailers have moved to online marketing and distribution and sales of their products. So this innovation will be required at the private sector level, at the industry sector level, and at the government level.
Excellent. Thank you, Bill. One question that we are receiving online right now, and this is for either Shannon or Bill, is it too early to know what jobs or types of jobs could be permanently lost or replaced with newly adopted online alternatives?
So I think it's probably too early. I'll let Shannon, who's the expert on these things, weigh in on this. But there's been some consumer behavior research that's been fascinating. McKinsey put something out in recent days that showed significant shifts in consumer intent towards purchasing certain products and services in the weeks ahead during the stay-at-home orders, and I think there's others who've done research about what is likely to last in those shifts in consumer behavior and consumer intent. And I think until we see a little more of that, it's hard to know. There are those who believe that, for instance, in our food and accommodation industries, that people will long for getting out and having a dinner with family and friends. They'll long for traveling again. But how much will they be comfortable doing that given the safety issues? How much will they find entertainment preferable to consume online through streaming services as opposed to in theaters? So I think it's a little early for us to know which jobs may be completely lost, but I think we can safely say that there will be substantial lasting job losses in the industries, the service industries that require physical contact, as less people are going to be comfortable dining or going to the theater or going to the gym in crowded places. So it just remains to see how businesses innovate and create alternative ways for people to consume their product and service in safe ways and bring them back as customers.
There's definitely going to be a change in consumer behavior that's going to impact, as Bill said, the jobs that will be returning quickly and then will be growing in the future. There's also the stay-at-home order has accelerated everyone's adoption of technology. So industries will most likely be transformed. So the way you do your job duties will be changed. So in education, you have people who are using planning software that helps them conduct their classes, and where that wasn't something that was commonplace before, they've had to adopt that new technology, and it's being widely used, and moving forward will probably become a regular part of their toolbox. So the way we're doing our jobs are changing. We're more connected now by necessity with adopting all of these different work from home platforms, whether it be Microsoft Teams. Everyone now knows how to use Zoom pretty proficiently. So where it was maybe a bit spotty before, although I'm often on mute, as Bill pointed out earlier. So the way we do our jobs is going to be different. And that combined with changes in the way people are responding or the after effects of this global health crisis. So they might be have an aversion to attending events that are large. They, as Bill said, you're not going to want to dine so closely together anymore. So the combination of the two things, the push for everyone to work from home if they have the capability to do so, and the after effects of changes in consumer behavior will make things a little bit different than what we were used to before.
Two other points to add. One is on supply chains, which are changing dramatically, and that could help us in a manufacturing center like Los Angeles County, as many industries have recognized that their dependence on foreign suppliers who may see disruptions between that market that is supplying essential components of our finished products or finished products themselves can create substantial risks and bottlenecks in their own supply chains, are likely to bring some of that production activity back here to the US. And I think other countries will bring it back into their own markets. So that may create some new manufacturing opportunities. And it remains to be seen how substantially supply chains will shift, but there will be shifts. We recognize how many of our pharmaceuticals are either made in China and India, or the underlying chemicals from which they are made are produced in China and India, and limitations in accessing those present a national health risk, and other industries present national security risks. So I think you'll see some substantial changes in supply chain. And the other point is automation. There have been some, in my opinion, dystopian views of people no longer wanting someone to deliver their food by hand or to prepare their food by hand, and that could lead to the sort of drone deliveries that Amazon and others were talking about, delivering food or other products to our home without being touched by human hands, or meals being prepared other than by human hands. I hope we don't see much of that, but depending on public fears, when we move out of the stay-at-home orders and people begin to circulate again in society. If there are a number of additional cases that start occurring, there may be those entrepreneurs who will offer alternatives to human-prepared and human-delivered food. And that could then lead to significant dislocations that could be permanent in the food industry.
Excellent, thank you. And we have time for one more question. This is another one that came in regarding models. Perhaps Shannon, is there a model that shows the speed of recovery related to the length of the stay-at-home order?
I don't know, but I would encourage you to read the paper by the Federal Reserve economists. There were some suggestions that there was, I think, quicker and stronger recovery in those markets. Now, Shannon wisely points out to me when I share that study with her that 1918's economy was very different than 2020's economy, so we can't draw too much from that. There are a lot of other variables and factors at play. But if one's economy suffers because of the extraordinary number of people infected and lives lost, it could stand to reason that there are substantial negative factors towards recovery. But by the same token, when you shut off your economy as long as we have and may continue to here in this region, you have a lot of people out of work, which changes their ability to be able to consume. And if you lower consumer demand as much as we've lowered the supply of industries and products and services available to us, it can have lasting impacts. By the way, I see quickly in the chat box someone asking about the media and entertainment industry. This production area is a real challenge. Our news organizations were the first to figure out how to maintain some essentiality on their news sets, separating their anchors by 6 feet, moving other people in the studio farther and farther apart, using their automated robotic cameras, by the way, in many newsrooms. The rest of the entertainment industry, which is associated with many of these same news producing companies, has been struggling to figure out how to do this. You saw, if any of you were watching Saturday Night Live, did their first episode from home this past weekend. And I did enjoy it very much. And so there's some ability, as the late night hosts have been producing their late night shows from their homes, and other shows are doing that. They're learning how to produce from remote locations. But situation comedies, family comedies, dramas, most feature motion pictures in which actors have to be close together is going to be difficult. And so they're going to have to be testing protocols in place to ensure that people who are asked to have a love scene together are not likely to be carrying and transmitting the virus. It's going to be challenging for the entertainment industry to develop safety protocols. And there have even been some press in the last few days about substantial room for improvement on location sets as well as studio sets for sanitation and cleaning between days of production. So I think there's going to be a lot of innovation, and that's going to create opportunities for companies to step in and offer opportunities to sanitize, offer opportunities to provide safety equipment, offer opportunities to monitor cases, as well as offer therapeutics, antivirals, and vaccines. And I will close my comments by noting how many of our healthcare and university research partners here in Los Angeles are doing just that. Many of our hospitals, public and private, developed their own test ability weeks and weeks ago before tests were available from national sources, and they're continuing to provide their own testing resources. There are dozens of clinical trials underway in our private nonprofit hospitals, in our public hospitals. There's extraordinary work going on at Cedars and UCLA and so many of the other hospitals and healthcare systems throughout the region. And I'm gaining confidence, as I think the public markets gained confidence last week, about the progress of some of these trials of antivirals and different therapeutics and the progress being made to develop vaccines. There's obviously a global race to do that. So I think once those things are in place, society will be, I think, willing to take greater risk about letting us all get back to our normal business, knowing there'll be treatments for us if we do contract the virus, and ultimately vaccines to prevent the vast majority of us from contracting it in the first place.
Excellent. Well, thank you very much, Bill and Shannon, for once again sharing your insights this week into the economic implications of COVID-19 and providing answers to some of the questions that were submitted. Once again, to all of our attendees, please email us any additional questions you may have and email it to shane.cullen@laedc.org. You can see that at the bottom of the current slide. And we also hope you will join us once again next week on Monday, April 20th at 11 a.m. for the next webinar.
And Shane, please let me add our resource page, which more than 53,000 of you have visited in the first few weeks. That's at laedc.org/coronavirus, laedc.org/coronavirus. And please contact us at COVID-19response@laedc.org if you need help or follow up on any of these issues. A number of our members and partners in the community have asked for additional help identifying loan and grant programs. We have an entire team devoted to doing that for you. So please, you'll find many of those resources at the page I cited. Shane can send out that contact information afterwards, but we're standing ready to serve you.
So thank you again, everyone, and have a wonderful week.